Right now there are two very different ways to get your Medicare benefits in America. One is the traditional way that most people know about. The other is a newer option that over 34 million seniors have already switched to, and millions more are switching every single year. Some people say it is the best thing that ever happened to their healthcare. Others say it trapped them with hidden costs they never saw coming. So which one is right for you? In this video I am going to explain Medicare Advantage, also called Medicare Part C, in the simplest way possible. What it is, how it works, what it costs, the benefits most people do not know about, and the hidden dangers you need to watch out for before you make any decisions. This is one of the most important Medicare decisions you will ever make, so stay with me all the way to the end. And before we dive in, if you find this video helpful at any point, please tap the like button. It helps other seniors who need this information find this video too. First, let us understand exactly what Medicare Advantage is. In our previous videos we talked about Original Medicare, Part A for hospital coverage and Part B for regular doctor visits. Original Medicare is run directly by the federal government. You pay your premiums, you go to any doctor who accepts Medicare, and the government pays the bills. Medicare Advantage is completely different. Medicare Advantage is when the government says to a private insurance company, "Here's the money we would normally spend on this senior's Medicare." You take that money and you run their Medicare coverage instead. The private company, like Humana, Aetna, United Healthcare or Blue Cross, then creates their own plan using that government money and usually adds extra benefits on top. This is why Medicare Advantage plans can offer things that Original Medicare never covers, like dental care, vision care, hearing aids, gym memberships, and even over-the-counter drug allowances. The private insurance company uses the government funding plus their own resources to bundle all of these extras together into one single plan. This is why it is also called an all-in-one plan. Instead of having separate Part A, Part B and Part D plans, you have one single Medicare Advantage plan that bundles everything together. Now let us talk about cost, because this is where most people get very interested. Many Medicare Advantage plans have a monthly premium of $0. That means you pay nothing extra per month beyond your standard Part B premium of around $202.90, which you pay regardless of which Medicare path you choose. So on the surface, Medicare Advantage looks incredibly attractive. You get all your Medicare coverage plus dental, vision, hearing and gym membership, all for $0 extra per month. It sounds almost too good to be true. And here is where you need to pay very close attention. While the monthly premium might be $0, Medicare Advantage plans have other costs built in that can add up significantly when you actually need medical care. These costs include copays every time you visit a doctor, co-insurance percentages for procedures and hospital stays, and most importantly something called a maximum out-of-pocket limit. In 2026 the maximum out-of-pocket limit for Medicare Advantage plans can be as high as $9,250 per year. This means if you have a serious illness or major surgery, you could end up paying up to $9,250 out of your own pocket in a single year before the plan covers 100% of your costs. For many seniors on a fixed retirement income, that is a devastating amount of money. Here is something that catches many seniors completely off guard when they switch to Medicare Advantage. These plans use networks. A network means the plan only covers you fully when you see doctors, specialists, and hospitals that are inside their approved network. With Original Medicare you can see any doctor anywhere in the United States who accepts Medicare. That is almost every doctor in the country. You have complete freedom to choose whoever you want. With Medicare Advantage you are restricted to the plan's network. If your favorite doctor is not in the network, you either pay much more to see them or you cannot see them at all under your plan. If you need to see a specialist, you often need a referral from your primary care doctor first. And if you travel frequently or live in different states during the year, network restrictions can make getting care very complicated. This is the #1 complaint seniors have after switching to Medicare Advantage. They did not realize they were giving up their freedom to choose any doctor they wanted. Now let us talk about what makes Medicare Advantage genuinely attractive for millions of seniors. The extra benefits are real, and for many people they make a huge difference in quality of life. Most Medicare Advantage plans include dental coverage. Original Medicare covers almost no dental care at all. No cleanings, no fillings, no dentures. Medicare Advantage plans often cover routine dental care, which for seniors can save hundreds of dollars every year. Most plans also include vision coverage, eye exams, and an allowance toward glasses or contact lenses. Again, original Medicare covers almost nothing for vision. For seniors who need new glasses every year or two, this benefit alone can be worth several $100s. Many plans include free gym memberships through programs like Silver Sneakers. For seniors who want to stay active and healthy, this is a genuinely valuable benefit that supports both physical and mental well-being. Some plans even include an over-the-counter allowance, a monthly or quarterly credit you can use to buy health-related items like vitamins, pain relievers, bandages, and other everyday health products at no cost to you. Here is the thing that most people selling Medicare Advantage plans will never tell you. Once you switch from original Medicare to Medicare Advantage, switching back is not always easy. If you decide Medicare Advantage is not right for you and you want to go back to original Medicare, you can do that. But here is the problem. When you go back to original Medicare, you will probably want to add a Medigap supplemental plan to cover the gaps in original Medicare. And here is where it gets complicated. In most states, insurance companies are not required to sell you a Medigap plan if you are switching back from Medicare Advantage. They can reject your application based on your health conditions. They can charge you much higher premiums because of pre-existing conditions. Or they can simply refuse to cover you at all. This means that the decision to switch to Medicare Advantage is one you need to think about very carefully before you make it. It is much easier to start with original Medicare and switch to Medicare Advantage later than it is to go back the other way. So let us recap everything we covered today. Medicare Advantage, also called Part C, is an alternative to original Medicare where a private insurance company manages your coverage using government funding. It often has $0 monthly premiums and includes extra benefits like dental, vision, hearing, and gym memberships. However, it comes with network restrictions, co-pays, and a maximum out-of-pocket limit that can reach $8,500 per year. And switching back to original Medicare after choosing Medicare Advantage is not always easy or even possible depending on your health. So which one should you choose? The honest answer is it depends completely on your personal health situation, your budget, your doctors, and how much you value flexibility versus extra benefits. There is no single right answer for everyone. What matters is that you now understand both options clearly enough to make an informed decision. If this video helped you understand Medicare Advantage, please give it a thumbs up right now and share it with a family member or friend who is approaching Medicare age or already confused about their options. You could genuinely save them from making a very expensive mistake. And please hit the subscribe button because tomorrow we are covering Medicare supplement plans, also called Medigap, which is the solution that fills in all the gaps that original Medicare leaves behind. That is a video you absolutely do not want to miss. I will see you in the next one. This video is for informational purposes only. It does not constitute medical, legal, or financial advice. Medicare rules, costs, and plans change annually. Always verify current information at medicare.gov or speak with a licensed Medicare advisor for your personal situation.